Good morning, Mr. Kerr. We'll begin with the statement of receipts and payment 2016 2015. 2015 being the page 10.
Honorable Chair, I can clarify on that. The financial statement is limited to 2016, and it's the ML that was expanded to July 2017. Yes, please. You know, it's comparative. In the financial, in the statement, it's comparative 15 and 16.
So the opening balance, we have our subvention account that's with Guarantee Trust Bank. The opening balance is 503,531.39. We have the totals receipts for the 2016. That's the subvention account or savings account, both GT Bank and Sky Bank, amounting to 2,514,106.36. That's the total receipts for 2016. Then when we come to the total subvention receipt, this amounted to 21,016,071.36. So this was the total available fund for the year 2016. The payment made from PE, that is salaries, equipment, furniture and maintenance, gross dressings, food and sundries.
Thank you, Chair, for letting us know. we, we, will get, we will get you somewhere.
Okay, our total receipts, the total funds available for 2016 is 21,016,071.36. Total payments made during the period, that's 2016, amounted to 18 million 872,723.64. So our surplus and for the period 2016 is 2,143,347.72 as at 31st December 2016. Our statement for cash flow for the period 2016, total cash received 18,501,965. Total cash payments 18,872,722.23.64. Our reserve deficit was minus 370,758.64. Then our opening cash balance was 2,514,106.36, giving us a closing balance of 2,143,347.72. So now study to the 2016 losses and payment, not number one. Okay.
Should I read out the opinion? It's on page 9 of the report. Unqualified opinion. We believe that the audit evidence that we have obtained is sufficient and appropriate to provide basis for our unqualified audit opinion. In our opinion, the financial statement presents fairly, in all material respect, the receipts and payment of the Bundung Maternal and Child Health Hospital for the years then ended 31st December 2016. Thank you. Page 21 of the report. Cash collection and custody. Standard practice requires that management employ adequate measures in order to ensure collection and custody of cash resource. Our audit procedures reveal that the cash collections were banked weekly, and the collection is kept in a till in the intervening period. We have also found that till did not have a proper locking system. Recommendation: management is urged to invest in a proper safe for the keeping of cash collections. Additionally, the banking of cash collections should be done more frequently to avoid keeping cash for undue period of time.
Yes, thank you.
No, it's then on page 22, the non-current asset register. Review of the non-current asset component revealed the following findings. The procurement unit was found to still be in charge of guardianship of the non-current asset register in spite of our recommendation for its cessation. This is still coupled with the fact that items procured by the procurement unit are directly delivered to the user department rather than transit through stores. The non-current asset register was also found to have key information relating to the assets missing. Details such as cost as well as reference numbers are largely missing from the register. Our physical verification exercise also revealed that certain items were not found at the places recorded in the register. Recommendation on page 23. Management is strongly urged to ensure that this recommendation is implemented without further delay to mitigate the risks of misappropriation of assets and make sure that proper internal controls are in place at all times. Non-current asset registers should be comprehensively completed with all relevant details, and any subsequent movement will be updated on the register therein. On page 25, stores management. Inspection of the stores of the hospital revealed the following. Physical tally as well as the soft copies are not up to date with the movement of both food items and drugs. We found instances where issuances and receipts have not been recorded in the books. We also found that some drugs are unsealed and used while still on shelves. There was no evidence that such issuances were administered by trained staff, and these were also not recorded. The stores were also not found to be in air-conditioned state to ensure that drugs which require cool temperatures are preserved. We have also not found any evidence of review order over the store's administration. Recommendation: the storekeeper is strongly urged to ensure appropriate record keeping over the movement of items to ensure safekeeping. Administration is advised to institute proper monitoring and review mechanism to ensure compliance. Concealing and usage of drugs from the stores must cease immediately. All drugs should be dispensed at the appropriate points and by trained staff. Management is also urged to look into the possibility of installing air conditioning at the store to ensure that drugs maintain appropriate potency. Free maternal services. The Bundung Maternal Child Health Hospital is specialized in child and maternal health and has thus attracted mainly patients from two groups. The augmentation of the facility, especially the installation of the state-of-the-art work, has intensified the pressure, with many more patients from far and wide lining up to benefit from the service not available in other health facilities. This has resulted in an influx of patients beyond a normal capacity, especially with the maternal registration. We also found that both services are completely free of charge due to a government policy. The above, coupled with slashing of subventions, has seriously impacted the spending power of the hospital. Our review revealed that even remunerations had to be supplemented from the drug revolving fund, which is primarily meant for procurement of supplementary drugs. Conclusion: the above finding has seriously affected the effectiveness of service delivery in terms of purchasing power, the stark disparity between the services offered with the resources available to sustain it is fast becoming unsustainable. The effect of the budget cut was claimed to be responsible for the non-availability of most of the supplementary drugs and other administrative supplies. Recommendation: the hospital board, in close collaboration with the management, is urged to engage the Ministry of Health on the issue with a view of finding settlement designed to ease the current predicament. The Ministry of Health's attention is also hereby drawn to the situation and urged to prioritize the plight of the hospital in this regard. In the meantime, the management and board is urged to explore other means of sourcing to cover the shortfall, whilst also ensuring that current austerity measures are maintained to avoid crisis. Then on the follow-up on the prior year, statement of financial position not implemented, bank reconciliation implemented, staff master file or establishment register not implemented, non-current asset not implemented, fuel implemented, staffing partially implemented, staffing specialist not implemented, equipment partially implemented, infrastructure partially implemented, and drugs not implemented. Thank you.
Can we now move to GPPA compliance report 2016-2017? Okay, can you also summarize on the key issues?
Thank you very much, Honorable Chair. May I refer you to page 7?
Chapter 3, Findings, Observations, and Recommendations. Non-compliance. The accounting officer did not appoint members of the contracts committee formally and in written. Page 11. The accounting officer did not ensure that the annual procurement plan to be prepared for the year under review, as stipulated in Section 29 of the GPPA Act. The accounting officer did not appoint members of the inspection and acceptance committee as required by GPPA Regulation Section 62, 63, 64, 66, and 67. Implications. Procurement process may not be followed in the absence of an SPU. Persons can easily avoid responsibilities when a misprocurement is detected. Accountability cannot be assured. Disobedience to statutory requirements. Recommendations. The action officer should appoint members of the inspection and acceptance committee as required by the GPPA regulation, or appoint someone not part of the procurement process to inspect the goods supply as required by the Act and the regulation. Page 13. Non-compliant. The SPU does not ensure that the supplier signed the purchase order, prepared some of the procurement transactions for the year under review. BUNDUNG Maternal and Child Hospital does not include evaluation criteria in solicitation document for 101 sent to the supplier in some procurement transactions during the year under review. The review team observed that some non-SPU members were conducting procurement, which is a violation of GPPA Act 2018. Most of the RFQ transactions did not have, that is upon 101, attached for the period under review. The SPU did not maintain comprehensive filing for the procurement transactions, and LPOs as local purchase orders were not signed for the period under review. Implications. Transparency of the procurement process could be compromised. Non-signing of the purchase order by suppliers may lead to potential conflict, especially if one part defaults in his duty under the contract. The absence of evaluation criteria may lead to wrong award.
Can you just, after reading the non-compliance, can you just go to the recommendations to save us more time?
Recommendation. The SPU should include the evaluation criteria in the solicitation document sent to the suppliers, which will help in the evaluation process and recommendation for award. Should ensure that all LPOs are signed by both parties, including the suppliers. Non-members of the SPU should desist from conducting procurement. Page 15. Non-compliance. There is no evaluation committee established by BUNDUNG Maternal and Child Hospital. There is no evidence of evaluation report by the contracts committee and no indications that individual scores were awarded by each evaluator or ranking for each quotations received as per regulation. Section 62, 63, 64, 66, and 67. BUNDUNG Maternal and Child Hospital has not established the evaluation committee as required by the regulation. Recommendation. The PO should establish the evaluation committee as required by the regulation. BUNDUNG Maternal and Child Hospital should ensure that the evaluation committee will generate evaluation report for the evaluation process. Page 16. Non-compliant. Bundu Maternal and Child Hospital has not established the examination and receipt committee as required by GPP regulation 133, 134, 135, and 136. Recommendation. We recommend that Bundu Maternal and Child Hospital establish the examination and receipt committee as required by the regulation. In page 16, non-compliant. The PO has not maintained a comprehensive and individual files for each procurement activity. The procurement files review are incomplete for some files which contravene GPPA section 35.2. There are no receipt and delivery notes, and in some instances, no good receipt note attached in the procurement files. Notwithstanding, the files are marked with the relevant PV number. Page 17, non-compliant. Some procurement proceedings are not initiated using an official procurement requisition form 100, which contain all necessary information pertaining to the procurement in accordance with the Act and the regulation. Sometimes requisition form 100 is filled after collecting invoice from the supplier. Recommendation. Page 18. We recommended that Bundu Maternal and Child Hospital to initiate the procurement proceedings using National Requisition Form 100. The same page, non-compliant. The PO does not carry out pre-qualified proceedings to determine an approved list of registered suppliers as required by the Act. Recommendation. The PO should pre-qualify suppliers as required by Section 23 of the Act to assist in arriving at the list of registered or approved suppliers for whom to solicit quotation or single source from. Page 19, non-compliant. The PO did not have any specific program in place as a way of supporting SMEs and has not applied preference and reservation in its procurement as provided for in GPPA Act and the regulation. Recommendation. The PO should apply preference and reservation to promote the local industry and provide procurement opportunities to the disadvantaged group as provided in the objectives of the Act. Page 20, non-compliance. The PO does not undertake market survey and analysis of suppliers and price in the market during the year being reviewed to inform the placing order as required by the regulation. PO does not negotiate to get better offers as recommended by the regulation for single source procurement. Recommendation. The PO is encouraged to continue to undertake market research and analysis more often, preferably on quarterly basis, to keep it abreast of current trends to inform the placing order. The PO should enter negotiation for single source procurement as required by the regulation and provide negotiation reports. Page 22, non-compliance. There was no secure tender quotation box for the receipt of quotations or tenders from the prospective suppliers as provided for in regulation. Recommendation. For purpose of integrity of the procurement process in line with the objective of the Act, there is need for Bundu Maternal and Child Hospital to have both tender and quotation box in secure designation within their premises, preferably next to the CEO's office. Bundung Maternal and Child Hospital suppliers should be sensitized to start delivering quotation and bids by tender quotation box. Page 23, specific finding. We have procurement of food items, category goods, amount to 52,750, awarded to Majau Trading, RFQ method. Non-compliance. There was no minute of the contract committee to approve the procurement as stipulated in Regulation 28 of the GPA Regulation, Section 12(7)(b) and 2 of the GPB Amendment Act. There was no delivery receipt to show that the procurement was complete as stipulated in Section 35(2) of the GPB Act 2018. There was no procurement documentation such as GPPA Form 100, 101, 102 were not attached as stipulated in Section 35(2) of the GPA Act 2018. There was no inspection committee to inspect the good as stipulated in Section 133 to 136 of the GPA regulation. There was no evaluation report among the documents provided to the reviewer. Page 24, procurement of building materials, category goods, amount 385,750, awarded to Jai Construction, RFQ. Non-compliance. There was no minutes of the contract committee to approve the procurement as stipulated in Regulation 28 of the and Section 12(7)(b) and 2 of the GPB Act 2018. There was no delivery note to show that the procurement was complete as stipulated in Section 35(2) of the GPB Act 2018. There was no procurement documentation such as Form 100, 101, 102, and 012 were not attached as stipulated in Section 35(2) of the Amendment Act 2018. There was no inspection committee to inspect the goods as stipulated in Section 133 to 136 of the GPA regulation. There was no evaluation report among the documents provided to the reviewer. Page 25, procurement of air conditioner, category goods, amount 449,100, awarded to timber and furniture. Method RFQ. Non-compliance. The procurement documentation such as receipt, GPPA Form 100, 101 were not attached as stipulated in Section 35(2) of the GPA Amendment Act 2018. There was no inspection committee to inspect the goods as stipulated in Section 133 to 136 of the GPP regulation. There was no evaluation report among the documents provided to the reviewer. There was no minutes of the contracts committee to approve the procurement as stipulated in Regulation 28 of the and Section 12(7)(b) and 2 of the GPP Amendment Act 2018. There was no delivery note to show that procurement was complete as stipulated in Section 35(2) of the GPP Amendment Act 2018. Page 26. Procurement of fuel. Category good, amount 50,000. Awarded to Atlas, single source. There was no framework agreement between Bundung Maternal and Child Hospital, and no contract document was provided for the review team. The procurement is above the single source as stipulated in the GPP Act and the regulation. Page 28. starting from 27, that is procurement of furniture, goods, category goods, amount 18,000, out to 1+1, single source. There was no delivery receipt as that's non-compliant. There was no delivery receipt as stipulated in section 35(2) of the GPPA Act 2018. There was no inspection committee to inspect the goods as stipulated in the regulation 133 to 136. The documentation was incomplete because there was no attach of good receipt note, delivery note to show that the procurement was completed as stipulated in section 35(2) of the GPPA Act. Summary of observation. We observe that Bundung Maternal and Child Hospital does not enter into framework agreement with written procurement. GPPA Form 101 was not administered in most of the RFQ transactions 2017 to 2020. Contrast committee on the year review are not formally appointed. There is no evaluation and inspection committee. The team has also observed that Bundung Maternal and Child Hospital sometimes non-SPU members do conduct procurement, which is an illegal act in the Act and the regulation. We also observe that GPPA forms are mostly filled after the procurement process, which is a serious violation of GPPA Amendment Act 2018 and the Regulation 2019. RFQ transactions had no specifications developed as part of the solicitation documents. During the period under review, delivery notes are not to confirm and not attached to confirm the receipt of the goods bought. The procurement does not keep records of the procurement transactions. We conduct interviews with some key personnel who were involved in the procurement process of Bundung Maternal and Child Hospital. Overall, the conclusion of the observations suggests gross misprocurement and non-attainment of value for money during the period under review. Recommendations. It is recommended that Bundung Maternal and Child Hospital to establish disposal committee, Bundung Maternal to ensure that GPPA reporting forms are administered at every stage of the procurement process. Bundung Maternal and Child Hospital will have a framework agreement for routine procurement items, e.g. fuel, maintenance of vehicles, stationaries, medical drugs, and ensure that suppliers are registered with GPPA but subject the procurement process to competition and seek approval from GPPA. It is recommended that Bundung Maternal and Child Hospital to ensure that all procurements are conducted by SPU. The SPU should directly answerable to the accounting officer, the CEO. To request training for contrast committee members to have a better understanding of the right procedures of public procurement. To always seek advice and guidance from the authority on procurement related issues. SPUs will ensure that all GPPA forms are administered and attached on each transaction. SPUs should ensure that monthly reports and prior approvals are sent to the authority as explained in the exit meeting. Page 30. Conclusion. Using the above compliance-related variables and specific findings on some of the procurement transactions conducted for the period under review, Bundung Maternal and Child Hospital was found to be 50% for 2017 to 2021, which fairly compliance with the GPP procurement, Gambia Public Procurement Authority Amendment Act 2018 and Regulation 2019. Thank you very much.
Yes, thank you very much. So now can the management give us a summary of the activity reports 2015 to 2017.
Thank you very much, Mr. Chair. I now read the summary activity report for Bundung Maternal Child Hospital for the period 2015 to 2016. Bundung Maternal Child Hospital was formerly called Jammeh Foundation Peace Hospital, started as an outreach reproductive and child health clinic under the Serekunda Minor Health Center. No, I made a summary. Later on, it transformed to a minor health center providing basically reproductive and child health services, including deliveries with limited inpatient services, mainly for children. In 2002, the center became a fully fledged maternal and child hospital, providing a wide range of reproductive, maternal, neonatal, and adolescent health services, including family planning. This report I'm reading is for the period 1st January 2015 and 31st December 2016. The report attempts to outline the management and administrative structures of the hospital, describe the clinical service offered in the hospital, detail the service delivery statistics for the reference period, chart out initiatives or interventions implemented during the period under review, and enlist attainments registered and challenges faced. Description of the hospital. The primary roles and functions of these hospitals are to provide high quality tertiary medical care services, including preventive, curative, rehabilitative services, particularly for women and children. To serve as a referral center to peripheral health centers located within the locality and beyond. To serve as a training and learning center for healthcare professionals, including medical doctors, nurses, and allied health professionals, and to serve as a public health research center. Bed capacity. The hospital has a bed capacity then of 90, 86 admission wards beds, and 66 delivery beds. Distributed as antenatal and postnatal ward was 13, high dependency ward was 10, neonatal intensive care 20, pediatric ward 24, accident emergency 10, antenatal 4, labor ward 6, and operating theater 5. The services, the health services provided can be classified into comprehensive reproductive, child, adolescent, and family planning, general OPD service, inpatient service for mainly maternal and pediatrics, laboratory services, surgical services, particularly obstetric and gynecology, management of gender-based violence victims, public health services, including immunization, organization, management, and administration. For effective functioning of the hospital, established are 1. Hospital Management Board, appointed by the minister responsible for health in accordance with Medical Service Act 1994. The Hospital Management Board functions include monitor the affairs of the hospital, formulate policies in respect of the hospital, consider policy issues referred to it by the minister, approve the annual budget of the hospital, prepare annual report of the hospital activities, help mobilize additional resources and maximize cost recovery potential of the hospital, and help improve efficiency of resource management and services of the hospital. 2 is the senior management team headed by the chief executive officer, who is responsible for the day-to-day administration and management of the hospital. Establish a senior management team consisting of heads of department within the hospital. This SMT meets at least once every 2 months, and the SMT is the second highest decision-making body in the hospital. Its main responsibility is to ensure that high-quality tertiary healthcare services are delivered in the hospital at all times. Human resources. The hospital in 2016 has a staff complement of 293. Of those, 65.2% are female. Trained clinical staff, medical doctors, nurses, and midwives, pharmacy, and lab staff comprise of 104, that is 38.9% of the overall staff. The majority of the staff, 60%, are posted by the ministry to the hospital. Now, service delivery statistics. First, outpatient services. OPD attendance was 60,711 and 96,781 in 2015 and 2016, respectively. This indicates an increase of 59.4% between 2015 and 2016. The attendance by age group was 23,770, that is 39.2%, for 11,420, that is 18.8%, and 32,145, equivalent to 33.2% in 2015 and for 2016. This relates to the age group under 5 to 14, and 14 above 14 years, respectively. In 2016, it was 15.6% for children under 5, 51.2% for 5 to 14 years, and 33.4% for people above 14 years. The common conditions seen at the outpatient were hypertension, malaria, diabetes, diarrheal disease, pneumonia, skin infections, asthma, otitis media, to name but a few. 2. Malaria cases. In 2015, a total of 66,105 patients were tested for malaria. Of those, 11,717, that is 17.2%, tested positive. In 2016, 60,991 patients were screened for malaria, and 6,718, that is 11%, tested positive. These statistics indicate a reduction in malaria cases from 17.2% in 2015 to 11% in 2016. On bed net distribution to children under 5 years old, pregnant women, that is 4,112, were distributed. 4,112 nets were distributed in 2015, and 5,166 in 2016. Dental services. A total of 2,697 dental cases were registered in 2015, compared to 5,049 in 2016, indicating an increase in attendance by 87.2% between 2015 and 2016. The dental conditions seen were mainly oral thrush, toothache, gingivitis, dental abscesses, and those for tooth extraction. The increase in these dental cases also uncovers this suboptimal dental hygiene practice in this country. Mostly people here, a lot of people only do one time tooth brushing in a day, and most of the time you do it in the morning. It's better you do it when going to bed than you do it in the morning to prevent dental problems. Laboratory investigations. In 2015, a total of 195,379 laboratory tests were performed, compared to 156,247 in 2016. The most common tests performed were malaria screening, hemoglobin estimation, blood groupings, cross-matching, to name but a few. Tuberculosis cases. In 2016, a total of 896 cases of tuberculosis were diagnosed. Of those, 36.8% were male, while women comprised of 63.2%. The positive test rate was 15, implying that 1 in 7 cases were with tuberculosis. Antenatal care. In 2015, a total of 4,494 pregnant women were registered, compared to 4,974 in 2016. This implies an increase of 10.7% from 2015 to 2016. While the average monthly registration was 374 in 2015, in 2016 it was 415 women. Malaria prophylaxis. while 3,921 pregnant women received at least one dose of malaria prophylaxis in 2015. In 2016, it was 3,856. Late antenatal care registration is the cause of the decrease in uptake in malaria prophylaxis.